Hi, everyone. Welcome back to the podcast. I'm excited today. I've got a very special guest on the show. Tracey, welcome to the podcast.
Thank you. Pleasure to be
Now,
here.
I'm excited to have you on the show because we talk about obviously health a lot and women's health, and we have touched on mental health, but probably we haven't really dived into, mood and anxiety and that. So today is going to be a great conversation. But before we do sort of dive into the conversation, can you please introduce yourself to our listeners?
Sure, I'm happy to. So, I'm Dr. Tracey McCarthy, and I'm a medical doctor and a functional medicine psychiatrist. And what that means is I'm focused on finding the really root causes of symptoms like depression, anxiety, and brain fog, and addressing and correcting those so that people can feel great and get their lives back. And I do that through my private practice and through my online program.
Amazing. Well, I've heard of, functional medicine practitioners. They've kind of, we've that's definitely more mainstream now, especially if you're looking into sort of root cause of health issues, but not in the sort of mental health sort of space.
Yeah.
So that's a bit new to me also.
Yeah. And in fact, when I first heard about functional medicine and I got into it through I was very fortunate to really discover information on the role of inflammation and nutrition and was fascinated by this and couldn't believe I hadn't learned a lot of this in medical school. And the more I learned, the more I wanted to embrace these principles and spread the word. And I changed my own life. My husband changed how he was eating. And it was very exciting. But I kept thinking, does this actually apply to mental health? Because I was seeing these examples of gut health and fatigue and things like this. And it makes me laugh now that I ever felt that way because I was in such a siloed kind of place. Like that is very much our conventional medical model is everything's very separate, right? Like you see a GI doctor for this and a neurologist for that, and then no one talks to each other. So here I was still kind of struggling with this idea that everything's connected. And now it's so clear to me how everything affects everything. And so, of course, reducing inflammation and the tenets of functional medicine absolutely affect mental health. And it's my joy to get to do that with patients and really help them heal on that deeper level.
Mm. And I wanted to start off with the question, how much
Mhm.
is, sort of our mental health and maybe things like anxiety and depression related back to our genetics? And how much is related back to, say, diet and lifestyle and sort of healthy habits or the absence of healthy habits?
I love this question because it's a myth I really like to dispel. I feel like there has been such an emphasis in medicine on the concept of genetics here, and it's really not, borne out to be very helpful. There's a phrase in functional medicine that kind of describes it. They say genetics loads the trigger, but the environment pulls the gun. I've also heard people say maybe genetics is like 10% of something. I think about it like this. The genetic factor is sort of your predisposition to have something. And so maybe for you, when you get inflamed, you get depressed. And someone else, when they get inflamed, they get skin issues. Maybe it's not the same problem, how it shows up, but it's really all these outside factors. That's the environment, all the epigenetic factors, we call them, what we're eating, who we're hanging out with, do we have purpose in our life, where our toxin exposure is. The list is very long. These all add up and really turn on those genes for depression, so to speak. So I really want people to understand that it is not their destiny to have depression if it runs in their family. Like they are not fated and doomed to always have that. There is so much that can be done.
Mm. Well, I feel even just in when it comes to sort of physical health, maybe it's like high cholesterol or heart, diabetes and things like that. People are like, "Oh, it's genetic, it runs in my
Yeah. It's
family."
like a cop
And
out. Yeah.
yeah, sometimes they do use it as oh, that's why it's happened, so there's not much I can do. And being a nutritionist and a Pilates instructor, I'm always trying to educate people that there is so much that you can do,
Yeah.
exactly as you were saying before with that saying, you may be predisposed to it, but it doesn't mean that it needs to be expressed, if we can look at diet and lifestyle
Exactly.
factors.
Yeah, and when I
Now,
say it's a cop out, I was going to just say I don't mean that the patient or the person is making an excuse. It's more like that's kind of our society. That's just like, well, that's it. That's all you can do. And I'm just like you said, I really want to get the message out that no, there's a lot you can do. And that's exciting and that's good news. And you can influence how you feel.
Mhm. So let's dive into that and start with, what are the sort of basic things that people can start doing that can really help their mental health?
Yeah, it can begin with a lot of, there are many options for a simple first step to take. And I do recommend people just start with one thing, one baby step. That's a big theme of mine, just because those really add up. But there's a long list you get to choose. I mean, simple things that can impact inflammation would be things like sleeping at a regular time, trying to have a regular bedtime, making sure you're getting enough sleep. That's going to impact all your hormones. What's your light exposure? Do you get any daylight in the morning? That's going to affect what we call the HPA axis, the stress response, and your cortisol levels, which have a lot of impact on mood. Um, Moving your body, right? Are you sedentary? Do you get out? Do you walk? Do you get some strength training or some sort of exercise a couple times a week on top of movement? And then other things that people forget, like, do you laugh? Do you play? These things matter. Are you around people that are toxic, or are you around people that are good for you? There's a many factors, and there's a lot of places we can begin.
Mm. And I guess too, it's just making sure, as you said, doing it one step at a time so it doesn't feel
Yes,
overwhelming. Because I would assume,
totally.
that can be a really big thing, that if you're already struggling with anxiety or, depression and things, that you can probably get quite overwhelmed very easily.
Yeah, great point. I mean, I think we all can get overwhelmed, and you're more vulnerable to it when you're feeling bad. That's really true. And things can feel really impossible. But just doing one little thing can make an enormous difference, like choosing to meditate for 5 minutes a day with a guided meditation. Just to start building that habit, for example, would be a great way to reduce stress. Or, another thing that is a great hack for starting to reduce anxiety and inflammation that could be leading to depression is balancing blood sugar. That could begin with just making sure you have some protein at every meal, and starting with the protein before your blood sugar spikes from your carbohydrates, for example. Just pick one little thing. And then when it becomes a habit, you can pick something else on the list and start adding that in. And these things really add up quite quickly to having a big effect.
Mm. And you've mentioned inflammation a few times
Yes, I
there.
have.
Yeah. So let's, unpack that a bit. What is inflammation and why should we be concerned or thinking about it?
Yeah, great question. So, inflammation, we do tend to talk about it like it's all negative, and that's not really true. It's a normal response to injury or infection. It's your immune system mounting a response in the body that is necessary. When we are talking about it in the way that it's a problem, we're talking about chronic inflammation. So there's some kind of triggers in the body that are causing ongoing inflammation that is causing a lot of collateral damage, and you're never really able to repair and restore reserves to the organs and become resilient when you're chronically fighting this sort of war in the body. And so it really is a insidious thing. You can't always feel inflammation. Like an example would be high blood pressure. Most people don't know they have high blood pressure till they're at the doctor's office and they get their blood pressure taken. It's usually not very symptomatic, but that is driven by inflammation. And for example, with Alzheimer's, there's inflammation going on in the brain for a couple decades before people get the symptoms. So it can be silent, and it's really important to figure out the things that are leading to inflammation in your body so that you can turn that around, quell that inflammation, really dampen that fire so that the body can function right and you can feel good. Because inflammation, just having those chemical messengers of inflammation called cytokines circulating in the body, that alone can make you feel depressed. And if you can't, if that's happening, you're going to feel bad, and you don't have to feel that way.
Mhm. Well, I'm assuming there's probably many people sort of listening in, not even aware of the links between inflammation and mental health. I know they may have heard it in the news of inflammation, lower your inflammation so that your joints don't hurt, but not necessarily
Right.
for improving mood and, reducing brain fog and that as well.
I think that's really true. I mean, if you go to your doctor about depression or anxiety, they're not going to talk about this, unfortunately. And if we look in the research, though, we see, for example, people who take a medication for depression, like a SSRI medication, like fluoxetine or Prozac, for example, when they respond to it and it does lower their depression and decrease their symptoms, their inflammatory markers have gone down. We know that in those cases, inflammation has been reduced, and the mechanism that is not even really understood. And so, there's other ways we also have proof that inflammation is driving those symptoms. And unfortunately, most people are not aware of it, which is kind of my whole mission, is to see that, get people to see that connection and know that there's a lot of other pieces contributing to how they're feeling that they can actually influence and do something about. They're not limited to only taking a medication and having therapy. And therapy is super important, but it's not going to fix a vitamin B12 deficiency, for example. So I want people to realize this, that there is this connection, and that be empowered that they to actually feel better.
Mm. And I know gut health plays a big role in our mental health. And
Yes.
again, that might be sort of an area that people aren't aware of, and the connections between our gut health and our mental health. So, can you expand on that a little bit as well?
Yeah, happy to. I mean, it's such an exciting topic. There's just always more and more information coming out every day about the microbiome, which is the bacteria that are largely in the gut, and the influence of those on every part of the body. Honestly, Hippocrates had a very famous saying, all disease begins in the gut. And that may not be 100% true, but there's a lot of truth in it, that the gut is influencing everything. And, the brain is no exception. It's very sort of strange in our modern medical model how we really just think it's like so separated. It's part of the body, just like any other organ, and is hugely influenced by what's going on in the gut via the inflammation, via the chemicals produced by bacteria, or both positive and negative. When you have the right kind of gut bacteria, they're helping make calming neurotransmitters like GABA. They're actually sending anti-inflammatory signals to your body. um, they're helping have a healthy gut lining, which reduces leaky gut. And if you've got leaky gut, that's a real source of inflammation, because you've got things like proteins that aren't digested, or components of bacteria that are entering across that gut lining into the bloodstream and triggering the immune system to be on guard and attack it. And that's triggering that inflammation that then is systemic and affects the brain. So there's like all these ways that the gut is interacting with the whole body. And of course, that has a big impact on the brain's functioning.
Mm. And with that sort of relation of, if there's poor gut health, there's probably going to be more inflammation, and then, potentially
Yes.
more symptoms that you're going to see.
Yeah.
If someone's kind of making that connection that, oh, this could kind of be me, where can they start with their gut health to sort of all the, inflammation? What should they focus on first to really try to get that back under control?
Yeah, great question. I think it's really helpful to think about the microbiome in the gut like another organ, and that you want to take care of it. You want to be thinking, am I feeding the beneficial gut bacteria, or am I feeding the bacteria that I don't want to have overgrown that's going to cause more inflammation? And that's the fastest way to really influence it, is based on what you eat. I mean, you do get your gut microbiome through a number of ways. I mean, you're born with whatever you receive by passing through the birth canal from your mom, and then whether you're breastfed or bottle fed does impact it. How much antibiotics you've had has impacted it. What you've eaten your whole life impacts it. However, what you eat going forward will shift it. And so if you focus on a wide variety of colorful fruits and vegetables, you're going to be getting lots of fiber and what they call phytonutrients. The things that give the plants their colors are the things that feed the right kinds of bacteria, and a diversity of bacteria, which is important, which is why you want to eat a diversity of these colorful plants in your diet, and making sure that you are getting that. Again, the fiber is really important, because that's going to grow beneficial bacteria. So thinking in terms of feeding the good bacteria is a good place to start. And what you want to avoid to not feed the bacteria that's going to increase inflammation is sugar, for sure. Processed carbohydrates, these are the culprits, right? It's always in the end the same thing, right? Processed foods, we know they're bad. No matter which dietary sort of school you belong to, everyone agrees on that. And it's because they really feed the harmful overgrowth of bacteria that lead to lots of inflammation, lots of symptoms, and lots of suffering. So that's where I always would start, is look at what you're eating. With every meal you eat, you're choosing kind of which type of microbiome you're supporting. And you
Mm.
can really make a big difference just within a couple of weeks if you change how you're eating.
Now, I totally agree with everything that you said, but I feel that there may be people listening and going, I totally get that, but I work full time. I'm a
Mm-hmm.
single mom. I
Mm-hmm.
don't have a heap of money. And
Mm-hmm.
you know what? Those processed foods, they're quick and easy. And
Mm-hmm.
when I'm short on time and money, because they're often fairly cheap sometimes, or they're more often on special, it's a way that I can get that food on the table quick and eat something. So, how do you sort of, overcome those sort of objections that you may hear?
Yeah, that's a great question. And we do, in my practice, we support our patients with this question all the time. And it looks different for different folks. Um, when one has more resources financially, but not enough time, there are a lot of things you can do. Like there can be meal delivery services, for example, in different areas that can be really, really high quality, the right fats, lots of great plant food, making sure you have good protein, clean protein sources. But, unfortunately, it really comes down to we do all need to know how to cook. I really think this. And I had to learn it kind of later in life. And luckily I ended up really enjoying it because I like knowing that I'm making stuff that's good for me. But I'll tell you, there's a lot of tricks to making it not take all your time. And there's a lot of great books out there about this. One of my favorite ways that what we do in our family is we cook a bunch one day of the week. We have a kind of a big cook up on Sunday. We might grocery shop Saturday, and then I'm making double batches of things. I've got two growing boys, so they eat a ton. And so we are doubling or tripling recipes, and we're cooking a protein that we can have a couple dinners, and we might make a huge dish of like cabbage and bacon or something. And that would be a couple nights of our side dish. And we'll make a few things that we can have several times. And then we have a couple more quick meals that we can do easily as well. Where we can toss together a salad and have some kind of easy, clean protein with that. So there are ways to do it. And you just have to figure out the thing that works for you. Some people love slow cookers, for example, or I'm a really big fan of instant pots, pressure cookers. Those are one of my favorite tools. But learning some basics of cooking so that you can actually, make things at home is one of the best ways to start to be eating better. I mean, studies show that even no matter what you're cooking, if you cook at home, you're healthier. So it's kind of like, I feel like either you got to have someone cooking for you, you got to cook some yourself. That's unavoidable. But there's a lot of tricks online about fast recipes, how to batch cook, how to make it faster and easier. And there's a lot of different styles to do that, and that can work with any individual's lifestyle and sort of
Mm.
schedule.
Well, I 100% agree. And I'm a bit like you. I always, if I'm going to, make something, I'll do a double batch or do a bit of meal prep on the weekend. So then,
Mhm.
I'll make a batch of soup and then I know I've got lunch for the week and that sort of thing. So I think
Yes.
even, sometimes just being like having some organization to your
Yes.
week and, where maybe, you get organized on the weekend for the week ahead. I think that can really help a lot too, because sometimes things come up midweek,
Yes.
whether or not you've got to make an extra trip out with the kids or something from unforeseen pops up. And I love using my freezer too. So, I've
Mhm.
always got something in the freezer. So
Yes.
if worst comes to worst, I can pull that out too. And I find that's really helpful as well.
That's so true. And things, we all run into trouble when we haven't planned and then there's nothing in the fridge and we have no time. And so trying to like have some emergency things, like you say, the freezer. I think having quick snacks available in the fridge is really great. So you have something to turn to, like whether it's just carrot sticks and hummus or something like that, that's easy to do. And you don't have to cook to do that. You can buy a good quality hummus. You can buy a bag of baby carrots. There's ways to do it. You just have to, like you say, you have to plan a bit, and it makes a big difference.
Mm. And when it comes to nutrition deficiencies, how do
Mhm.
they affect our mental health? And, how do we work out if that's potentially something that may be affecting our mental health as well?
Such a good question. This is huge. I mean, most Americans, for example, are walking around with way too low a level of omega-3 fats, which we get from like wild caught salmon or sardines. or mackerel, for example. That's the primary source for it. And they have no idea that they're so low. And did I say Americans too? I'm sorry, because I know you're in Australia.
Yeah,
I would
but
say this is
it's
a
worldwide.
yes, this is
Yeah.
a major problem all around, because the flip side of it is everyone has got a high level of omega-6 fats, which are pro-inflammatory. They're like the gasoline on the fire, and the omega-3 fats are like they're anti-inflammatory, and they're quenching that fire. And we're out of balance. We eat tons of omega-6 fats. We do need them. They're also essential fats, but we have no problem getting them. We get way too much because they're in all of these processed seed oils like canola oil, for example. And that is in every processed food, practically in every restaurant food. So we're just inundated with these. So that just alone, that deficiency in omega-3s plays a huge role in just everybody walking around with a higher level of inflammation. And there's study after study on omega-3 fats and depression, and how when you really increase the level of omega-3s, you can reverse depression by quenching that inflammation. So that's a great example right there. Another one would be B vitamin deficiencies. I mean, these are the basics, but they're really big for people. Lots of folks are low in the B vitamin folate, for example, which plays a big role in mood. Or B12 is another one where they may not be eating it. If they're following a vegan diet, they're not going to be getting B12. They need to supplement. And also, lots of people I notice in my practice, they may be eating B12, but they can't absorb it because they don't produce enough stomach acid. And so a B12 deficiency is going to lead to mood issues for sure, and other health issues as well. So the B vitamins in general all have a lot of impact on brain health and how you feel. And so that's another place where deficiency is really obvious, having an impact. Another example would be zinc. It's another mineral that's important. Or magnesium. When it comes to anxiety, magnesium is like the place to start. Most people are low in magnesium because the soil's been depleted and we don't have the levels in our foods as we used to. And just supplementing with the right form of magnesium. And I say that because some are quite laxative and others are not. So you have to pick right for you based on your bowel function. But getting that magnesium can really help lower people's anxiety right away in certain cases and help them sleep better and feel more relaxed. But that's just, you need the magnesium. And if you don't have it, you're not going to feel right.
Mm. Well, I myself use topical magnesium. I often put that
Mm-hmm.
on just before going to bed, help relax muscles and stuff too. But
Yeah.
also, I take lots of other supplements. And yeah, I was just like, that's a way I can like put it
One
on
less
my
pill.
skin.
Yeah. Yeah.
One
Well, that's
less
a great
pill.
point. Epsom salt baths, right? That's another way to get magnesium for folks. And it does, there's other benefits to that as well. But yeah, making sure, and my advice to somebody who's struggling with anxiety or depression, I would say right away, like begin with these steps of making sure that you aren't deficient in this. And you don't have to test to know this, because the good news is eating a lot of these things is not going to hurt you, and these are safe to do some basic supplementation in. You're not going to suffer a problem from some additional omega-3s or some additional B vitamins or, zinc, as long as you're not going crazy with it. So I just think it's worth covering your bases, or magnesium, I should say too. That's such a critical one.
Mm. And when it comes to exercise, is there exercise that can be supportive and then maybe other forms that are not so no, not so supportive, or is it like, yep, if you feel inclined, go for it?
I think it's mostly the latter, like just moving your body in general is the most important thing. And movement is not even the same as exercise, right? Like, I think of exercise as like a workout, but movement is just getting up, getting down, not just sitting still all day and walking around, like changing position, stretching. And all of these things are going to help. I think that exercise can become a problem when it is so intense that it's actually depleting. And that amount looks different for different people and could be different for one person at different phases of life based on what they're going on, based on what's going on in their life. For example, like I always like to say, like, the time to train for a marathon is not like postpartum, going back to work full time, having all this stress. Like, you can't add that physical stressor on top of all those other stressors. It's too much. But there could be a time when you can handle that, So you got to weigh all the stress together and then make a choice on what to do. And you can really tune into your body and know, like, am I totally depleted after I do these workouts? Like, does it take me forever to recover? Well, that's too much. And when you're doing that, it's really raising your cortisol. That's that stress hormone that I mentioned earlier that is so connected to mood and all our other hormone levels, really, and our cognition. So the dose is important, but most people are erring on the side of they're not getting enough movement. And I think doing something you like, having fun, if it can be social, even better, if it can be outside in daylight, even better. But anything that's going to get you moving is going to be helpful. And it's just for those who are hardcore, be careful you don't overdo it, because that could backfire.
Mhm. And you talked about getting that connection and community. And I heard a saying recently that, we've heard that sitting is the new smoking. And now they're saying loneliness is the new,
Oh, yeah.
sitting in the chair, sitting for 8 hours a day, essentially. So can you expand on the importance of connection and how that influences our mental health as well? And I think, over the last few years with everything that's happened in the world and things moved online and closed down, and then they've potentially opened back up, but a lot of people haven't returned to the same, in face things they were doing previously.
Yeah, I love that you bring this up, because I think it is really important. I think it's helpful to think about how we evolved, like living in a tribal group, really being in physical contact with each other, seeing each other. Like, it's part of our DNA. And so if we're totally isolated, we're missing a lot of important inputs to our system. Just like I've mentioned, daylight's really important for setting hormones. It's like these exposures to people are important. So if making sure you have some kind of community. I mean, there's a lot of evidence that, like, lack of community, lack of a feeling of community is a major source of stress and will raise your cortisol and impact your health. So whether that's at your job or through a volunteer thing you do, or a sport or a church or whatever it is, like having people that you see regularly. And then I would add to that, positive touch, getting hugs. It raises your oxytocin. This really actually matters. And I think we really suffered from that during COVID, with people so isolated and not touching each other. And, so I think being just conscious of that, and, like, this is where a pet can be helpful if you're alone, right? I just be thinking, how am I caring for myself in this way? Do I have community? If I don't, how can I increase it? What would be a fun thing for me to do that would bring joy? And I could make some connections and be around people, because it actually is really important.
Mm. Well, I'm very lucky because, and, maybe you are as well. In the work that I do, I get to interact with so many people daily. So I feel like
Yeah.
that in itself, I'm seeing and talking and connecting, and connecting with people on a deeper level, because we're not just talking about, the weather. We're talking about, how their body is feeling. And I'm
Mhm.
touching them in the Pilates studio to give corrections and stuff as well.
Yes.
So I feel like even, if you're somebody listening in, maybe it's working with a trainer or something, you're still going to get connection and touch and, however you can form those relationships, they're
Mhm.
very important.
It's so true. And I think you hit on one other thing, because you're talking about working with them on a deeper level. What you've also described is you have a sense of purpose. And that's another thing that we know influences mood a lot. So feeling like you're doing something that's important to you, that's like contributing in a way that matters to you, or, that purpose is really important and can affect how you feel quite a bit.
Mm. And I would be remiss if I didn't bring up devices and social media, and because
Yeah.
everybody always talks about it, and I know a lot with children and stuff, they say please don't let kids on devices for too long. They've done studies
Mhm.
to show that it changes their brain waves and that. So can you touch on how the use of devices and social media can affect our mental health as well?
Yeah, I mean, you're absolutely right there. And there's really a lot of research coming out about this. So I think I think about devices, also kind of how I think about media and the news and stuff when I'm working with my patients. And it's all about mindful consumption. Like, you really have to have an awareness of how you're using something or how you're viewing the news, for example. Like, some people taking it in all the time and they're really causing themselves a lot of stress. Like, how much are you on that phone, and what does it make you feel like, when you're on that social media site and you go down that rabbit hole and suddenly you look up and it's been 2 hours? and checking with your body. Like, how do I feel now? Am I tense and stressed from everything I read? Am I kind of feeling like, that FOMO, like I'm missing out because everyone's doing whatever? It can trigger these feelings that are really not good for us. So I think that if you can start to be mindful and notice how you're feeling, that's going to give you some good guidance. But you're absolutely right. Like, even without that, we know from the studies that with the social media usage in teens is absolutely linked to depression. It's dangerous that way, I think. And we've got to be aware. And I think if you aren't feeling good, you got to cut out the things that you can identify that are making you feel worse, and figure out a way to interact with people that's going to raise your spirits and make you feel better and not bring you down.
Mm. And I think that can be really hard in a sense too, because one, they've shown that they've designed social media to be addictive. Like it's very common
Correct.
knowledge now that it was all designed to be addictive. And two, I was just speaking to my dad the other day and he was complaining because he's like, every time you go out now, you need a smartphone because you sit down at a restaurant and you've got to scan the QR code for the menu or whatever. And he said, I was trying to park the car and now I have to scan and go into an app to even pay for car parking. So, even for people that might want to take a break from using the device or whatever, it's part of society to a certain point that it can be hard to take a break.
No, that's true. I mean, you remind me of my son in school, 2 years ago. And, he was at the age where they're like, it's better not to have a cell phone. And he did not have one. But then this teacher was demanding that they scan a QR code and their Chromebooks couldn't do that. And I'm like, are you kidding me? You have this policy, but you don't, like, make it doable. Support us in trying to keep them off of these devices, please. But I think you're right. We live in the real world. And like your father's case, he might actually have to scan that parking app, QR code. But I think it's really all the rest of the time. Like, right. Are we, maybe trying to set some time where you keep that phone away from you at night, you put it down during the meals, it's in another room, and it's the mindful use of it and being aware of what you're doing. I mean, maybe you begin just with tracking your use, and then you start to notice, maybe track your use, like just have a little notepad. You kind of say, I was on this time and here's how I felt, and try to get that connection. And I think just some simple shifts like that, take those apps off your phone that are the ones that are addictive for you, right? So keep your phone more boring for you. That would be a way. But it is an uphill battle, just like it is with food, right? The processed food is addictive, just like the social media. It's cheap, it's in your face. And we have to work harder, unfortunately, in our society to be healthier. So it's really about that awareness. Once you learn about what foods are healthier, you can make different choices. It's the same with the social media and the devices.
Mm. And I think, especially when it comes to kids, it's about education as well. Same, you educate your kids around, what foods are healthy and what foods give you more energy and ones
Yes.
that may like contribute to constipation. My girls definitely know that.
Yes.
And then it's the same around the social, whether it's social media or device use too. It's trying to educate them and then also set boundaries where possible. It's a little bit easier when they're younger, not so easy when they get older. But I think too, if they can make that link with, the education, that can help as well.
I totally agree. And I've really seen that start to bear fruit with my kids with the food. It's been interesting now that I have a teenager and I see how he's really aware of this. And he'll tell me the things he mentions to his friends. I'm like, oh my gosh, it's all paying off. Like he's actually absorbing this information. And
Yes, it's great when you see
yeah,
that coming through.
it's exciting. It gives me hope.
Now, before we sort of come to a close, is there anything that we haven't covered that you would like listeners to think about when it comes to sort of mental health and, even relation to inflammation and gut health and that as well?
I just want to reiterate um, how much is within our power. And I don't mean that like we need to feel bad because we haven't done certain things and like beat ourselves up. I don't mean that at all. I just mean that it's a hopeful message of we can take steps that will add up and help us feel better. And what is so cool about that is you may be focusing it on for your depression, but then you're going to see other benefits like, oh, I sleep better, my skin is clearer, or, I'm not constipated anymore, for example, right? And just to know that these are so additive and so many of them are so doable, but the trick is just, again, baby steps. Don't try to overhaul your whole life. That will totally not work. You'll do it for a week or two and then you'll fall off the wagon. Pick one thing until it's an easy habit and then pick the next thing. And you can begin with more of the stress related, like, lifestyle factors, or you can begin more with the diet, or, begin with the thing that you're excited to try, that you can be motivated to do and it feels like a fun experiment to you. Do it and see how you feel. I think taking that attitude of curiosity and experimentation and sort of light-hearted about it is a nice way to work with yourself on it, rather than like, I have to do this, I'm beating myself up like that. We all kind of want to rebel from that. So really gentle with ourselves, curious, light, and baby steps. That is what I want people to embrace, because that is going to lead you down a path of feeling better and better and really healing your body.
Well, as you've sort of been saying, it is a lifestyle, these small changes that you make that become habits over time. And then we touched on it earlier about the people that you hang out with. How do they sort of affect, maybe some of these new lifestyle choices that you're trying to make too?
Yeah, this is so important and can be hard, can be really hard. Um, I see that in my own life, depending on which family I'm hanging out with, like what I'll be tempted to eat that I might normally never eat. And so it is tricky. And you can't obviously just, trying to get rid of your family if they're the problem. But who can you sort of cultivate? Who can you choose to spend more time with? Or who can you enlist their aid? Say, this is the thing I'm doing to help myself feel better. Can we do it together? Or, just thinking about sharing your goal and getting people sort of support in there. Not that you're going to change what they do. You don't want to put people on the defensive. That's not the point. But, a lot of people want to be helpful, so you can enlist their aid. But we are very influenced by who we're hanging out with and what they're doing. So if you know people who are healthy that are your friends, spending time with them, sharing your goals, getting their encouragement, that's going to help you. And sharing it with the others too, and see how they might be able to be supportive too, can help shift that.
Mhm. Amazing. Well, everything that you shared has been so great. And before we finish off, I always love to ask my guests if there's one piece of health advice that you could give that our listener could go off and instigate straight away after listening to this podcast, what would it be?
I think it would be taking steps to balance blood sugar, because this is an epidemic. People are riding the blood sugar roller coaster where it's going up and down and up and down, and they don't realize it. When their blood sugar crashes, it can trigger massive anxiety. So people can get a feeling of anxiety out of the blue and not realize that that's what's causing it. And that's because when your blood sugar goes way down, your body releases adrenaline to help. And that feels like anxiety in the body. And it can be a major reason people are waking up at night and then their thoughts are going and they can't get back to sleep right away. That can be a blood sugar crash as well. So what to do about it is to really some simple steps. Try to decrease processed carbohydrates, eat protein with every meal, and eat the protein first, because that's going to help balance the blood sugar. You can take a walk, even a 5-minute walk after dinner is going to help lower blood sugar. So moving your body, looking at those, what we call, macronutrient ratios, right? The protein, the fat, and the carbs. Make sure you have protein and fat at each of those meals, and get some of that protein in your stomach first. That's a huge difference. I mean, I've seen several patients that just making the change of like reducing sugar had a dramatic impact on their anxiety. When we make these tweaks on blood sugar, you see suddenly people are sleeping all night. It's very impactful. And I say this too, because it drives so many parts of our chronic health crisis, really. That blood sugar issue is driving a lot of people's high blood pressure, their fatty liver, obviously the diabetes, even ultimately some people's Alzheimer's. So it's just a major, major piece of the puzzle. I look at it like the low hanging fruit. So first, work on your blood sugar. It's going to help your health in all directions, but it will definitely help your mental health.
I agree. And I think it's great now that if you are really curious about that, you can get the, sensors that you can try. And you don't
Yes.
have to use them for a long period of time, but they can be very beneficial if you're not sure, what's spiking your blood sugar. And sometimes it can be very surprising what may spike your blood sugar. Yes and no. Some foods we know are definitely, but some clients have been like, oh, I was really surprised that that spiked my blood sugar. So I think that can just be another tool or an aid that if you are curious and you want a little bit more sort of real time info, they can be very helpful too.
I agree 100%. I use those a lot in my practice. I love people doing it for just 2 weeks. And I say, don't change how you eat. Just do this for 2 weeks. Eat all the foods you normally eat the things you would maybe indulge in and see what it does to your blood sugar and learn because it's very, very eye opening. And it is a surprise. And sometimes something you think is going to be bad is not. And then other things you would never have guessed. And they'll also see the impact of stress on their blood sugar. That
Mm.
will impact it quite a bit. So I think it's such a great tool if you can do it. It's really well worth it. And you're exactly right. You don't have to do it continually. I say do it for a while, learn what the issues are, do some experimentation to correct that. And then when you've got it dialed in, don't do it. And maybe check in again in a year or do it again then, like see how's it going. And even if you can't do a continuous glucose monitor, even getting a regular glucometer to check like when you're having, when you wake up at night I mean, by then it's probably going up again, but like you can start to do some basic checking of blood sugar. But if you can get a continuous glucose monitor, it is well worth it.
And also, I think too, it can be surprising because your reaction to different foods is very individual. What your
Yes.
friend may eat the same meal and they might not have the same, blood sugar reaction as you do. So that's
Hmm.
where you then could, have that meal and then instigate some of those changes. Maybe the next time you have your meal, you go for the walk afterwards, or you make sure you eat the protein first, or check it after you've had a really good night of sleep or compared to not having sleep and see how the
Yes.
cortisol affects too.
So true. And, I love what you said about the different reactions because also people, all carbs aren't created equal. Like you can have 50 grams of one type of carb, like say bread, and 50 grams of potato and not see the same type of blood sugar response. It's really interesting. So you can really personalize your diet and really stabilize your blood sugar in a way that without that data, you wouldn't know.
Mm. And, you just said then personalize. And I think that's the key here when it's coming to your diet and your habits and your lifestyle. It's really trying to personalize what is working for your body. And it might be a bit of trial and error. It's never,
Yes,
a
definitely.
linear, everybody wants to go from here to here very quickly, but it's always up and down and all the rest of it. But I think that personalization is really key no matter who you're working with, what specialist you're working with, rather than just getting some general across the board info.
Yeah, that's very true. And that's where I love the attitude of sort of curiosity and experimentation and just knowing like, oh, I'm curious what's going to happen with this and not being so intense about it and beating ourselves up is the way to embrace this because there is trial and error for sure.
Amazing. Now, where can our listeners reach out and connect with you?
Yeah, so I'm on Instagram at Dr. Tracey McCarthy, and I've got a freebie that I love to give people that, my mission is helping people see these overlooked physical causes of their mental health symptoms. So you can download that for free at drtracymccarthy.com/top 10. That's TOP and then the number 10. I encourage people to do that because I think there's a lot of good info in there to help you get started. Those would be the
Amazing.
two best places to go.
Well, I'll definitely link those up in the show notes too. So, listeners, you can head across there and find those links to reach out and connect with Dr. Tracy as well. But thank you so much for coming on the podcast. It's been lovely having you on.
Thank you so much. It's been a pleasure.